Okay. Well, I am Diana Williams. I'm your host for this evening. I'm a nurse practitioner and owner of Strategic Wellness Center. So, we're going to be talking about gut health, why that's important, talking about how to identify symptoms that the gut is not healthy, and then also, of course, how to go about treating and healing the gut. So this is a comprehensive review. We have divided this up into 4 weeks. So we're going to be meeting once a week for 4 weeks. We're going to kind of break it down into subsets. So we're going to do a brief introduction about everything we're going to be talking about tonight. And then week 2, we're really going to dive into how to actually begin the healing process of the gut. Week 3 is going to be more additional healing mechanisms and things to avoid. And then week 4 is going to be very much a review and then talk about the next step. So we're going to definitely put it into bite-sized amounts. We also do have some support for you guys. Most of you have already received the link for the WhatsApp. If you're interested in doing that, we encourage you to do that. Put any questions that you may have. If you find something really cool as far as a recipe, or if you tried something that you really enjoy, share it with the group. But it really is to be interactive. I don't have to be the only one. I definitely will be managing it and looking for any questions. But if you guys have answers or things that have helped for you, want you to be interactive and like do this as a group. The science, the research does show that any kind of group activity, people do have even better results. It's an accountability thing. It's a feeling of community as well. So would like to at least get started. If you want to put your name in the chat, if you feel comfortable with that, but also kind of who you are, where you're from, and then what are you hoping to achieve from this class, or anything else interesting about you that we may want to know. All right, so the components of the gut health. So gut health is not just, you probably have heard the terms leaky gut or gut dysbiosis or gut-brain connection. It's so many different variations of what actually makes a gut healthy. So we are going to be talking about each and every one of these on a specific level and very detailed. So gut microbiome obviously is the total sum amount of bacteria in the gut. All of us have tons and tons and tons of bacteria, most of which is healthy, right? We have more bacterial cells in our gut than we have human cells in our body. So we are predominantly what's in our gut. The whole old saying of "you are what you eat" is super true, because basically whatever we're feeding our microbiome, that specific microbiome, that bacteria starts to grow and develop. And that's a good thing, or it could be a very bad thing. So the gut microbiome is essential in overall health and wellness. We have seen gut microbiome changes associated with other chronic diseases as well. The gut-brain connection, you probably have heard this, but the gut and the brain are one continuous organ. Whatever's happening in the brain is going to affect the gut. Whatever's happening in the gut is going to affect the brain. So if we're going to have a healthy brain in terms of mood and focus, then we want to make sure that we're having a healthy gut. Diet, nutrition, I would say probably 80% of what's happening in the gut is dependent on dietary factors. How we can either destroy or improve gut through what we're eating. That's how we're getting our nutrition in. Gut inflammation. Inflammation is basically swelling. You can have swelling any part of the body. If the gut's inflamed, you can suspect that the entire system is probably going to be inflamed. The gut is basically the majority of how we get things into our bodies. You can also get them in from other means by inhalation and breathing it in. You get it through your mucous membranes, and you also get it from absorption from your skin. But the majority of things we take into our bodies coming by way of our gut. Hormone balance. People don't often correlate their gut with their hormones, but the gut is important not only for hormone manufacturing. We actually make a lot of our hormones from our gut, but we also detoxify our hormones from our gut. So having a healthy gut is going to affect our hormone balance. And then, of course, chronic disease prevention. All diseases begin in the gut. We've known this for centuries. Hippocrates, like the father of medicine, actually was the first one that predicted that, and we still know that that's true to today. So if you're trying to prevent any chronic disease, whether that's diabetes, heart disease, kidney issues, Alzheimer's, Parkinson's, then you have to address the gut. And this is very well established in literature. So some of the symptoms associated with an unhealthy gut are obviously digestive issues that we know that if we have constipation, gas or bloating, reflux, diarrhea, then that's probably a symptom that our guts are not healthy. That's a given, right? But only 80% of people with digestive issues actually have symptoms. We have this entire network of nerves in our gut, and sometimes those nerves are not functioning effectively. So we may not have the symptoms of gas and bloating and pain, digestive pain, but we can still have a very very unhealthy gut. I actually had a client of mine that she had full-blown celiac disease, and no one thought to test her for celiac because she was only having headaches. That was her only symptoms, was headaches. And I was like, out on a whim, I'm like, let's just test you for celiac. Let's just make sure everything's okay. And sure enough, she had full-blown celiac disease, but zero digestive issues. Your gut affects your immune system. So if you're getting sick a lot, or if you have an autoimmune condition, we know that that goes back to having an unhealthy gut. 70% of your immune system lies in your gut. Most of that is actually in your appendix, but also throughout the entire GI tract. So if you don't have an appendix, you're already going to have a weakened immune system susceptibility. But if you're having recurrent illnesses, lots of COVID, sinus infections, then you're probably dealing with an unhealthy gut. Skin problems. This is actually, if you know my story, this was one of my main root causes of, or main symptoms that I had an underlying root cause that was in my gut, going through my illness back in I think that was close to 2017 or so. I had a ton of eczema. I was covered head to toe in this very inflamed skin rash, and I was not able to get any resolution of my symptoms by just treating my skin. I actually had to treat the gut before my eczema went away. But the things like acne, rosacea, all of those are highly linked to a gut dysbiosis and gut inflammation. And so if you're going to treat these skin conditions, you have to go back to actually treat the gut. Mood imbalances, anxiety, depression, that whole gut-brain axis is going to be regulated by what's happening inside the gut. So we see diagnosis as well as symptoms of anxiety because of that, and depression as well. Unintentional weight changes. So typically it's going to be weight gain if the gut's not happy, but it can also be weight loss. If you have rapid weight loss and you can't explain the symptoms, then that could be a gut issue. And most of the time, you're also going to see an associated nutritional absorption issue. So malnutrition, vitamin D deficiencies, magnesium deficiencies, those kind of things, secondary to the gut's just not able to absorb its nutrients anymore. And the body actually can either gain weight or lose weight if the gut's unhealthy. Interestingly enough, and I think I talk about this in one of the other modules, but just to kind of mention that, you know, the whole world of GLP-1 right now, which is the injectable, the shot that's kind of getting a lot of attention in the press, that actually helps support weight loss and diabetes. Those are those shots like Ozempic, Mounjaro, Zepbound, and Wegovy. What they are is a synthetic form of a GLP-1 hormone. So GLP-1 is a hormone that is actually made in the gut. That's made specifically by certain probiotics, Akkermansia, and a couple of other ones. Those actually eat your food, particularly fiber, and then they start to basically create more GLP-1 in the gut lining. So if you do not have enough of that GLP-1 production because you don't have the right microbiome, then you can see weight changes, either appetite changes or full-blown weight changes. And that's why, you know, we do use a lot of those GLP-1 drugs in our practice, but we do that very intentionally while we're addressing the root cause and helping the body produce its own GLP-1 again. More conditions. So these are not just symptoms. These are actually true diagnoses. And this is 6 out of, gosh, so many that we put on there. So irritable bowel syndrome, obviously, that's very common. You know, conventional medicine likes to just tag everything as IBS, right? So if you have any kind of digestive issue, they can't figure out, they do a couple blood work and like, no, it's not this, it's not this. You just have occasional diarrhea, they'll give you, you know, something to block you up. Or if it's the opposite, you have constipation, then they'll give you something to help, like a laxative. But really, IBS is a syndrome of an underlying disease process that's that's affecting the gut. And if it is not treated, you're going to see some long-term issues. This was my issue. I'd had my gallbladder taken out when I was 16 years old, had a chronic constipation and irritable bowel constipation for years and years and years. And basically I would just take a whole bunch of synthetic chemical-based laxatives like Miralax for forever, decades, and essentially caused a lot of issues in my gut that actually did start the whole process of digestive reflux. Yes, but also mood issues like anxiety, depression. I had panic disorders secondary to what was happening in my gut, and then my skin issues as well. Inflammatory bowel diseases, those are things like Crohn's and colitis. Now, these are like gut issues on steroids. These are really bad conditions, and they take a multidisciplinary approach to it. We also see some autoimmune disorders, so things like celiac, yes, that affects directly the gut, but any kind of autoimmune condition actually has its roots in gut dysfunction. So things like rheumatoid arthritis, multiple sclerosis, we've seen things like Hashimoto's as well, which is a thyroid autoimmune condition. You have to have three things to actually have an autoimmune condition. Those three things are a family genetic trait. So somebody somewhere in the family had something autoimmune. It doesn't have to be the same autoimmune condition that you have. Number two is a trigger. That trigger for specifically a lot of women who have a significantly higher risk for autoimmune conditions is usually stress, sometimes pregnancy, sometimes an infection like COVID has been reactivating some of these autoimmune conditions. But the third things that you can have that we can actually treat is the leaky gut. So you have to have a permeable and healthy gut to be able to actually activate an autoimmune condition. So that's when we see people with things like celiac disease and Hashimoto's. Then we look back in the gut, like what's happening actually there. I've seen a lot of people who have Hashimoto's that actually have a gluten allergy, and the gluten looks molecularly very similar to your thyroid, thyroglobulin, which is a protein in the thyroid, is a receptor in the thyroid gland. So your body starts to attack itself when it starts to see the gluten. So that's why gut work is so important when you have with an autoimmune condition or even prevention of an autoimmune condition. Metabolic disorders like diabetes, insulin resistance, all those, and even cardiovascular diseases, heart disease is highly associated with what's happening in the gut. Neurological conditions, Alzheimer's disease, Parkinson's, but also things like autism are highly related to what's happening in the gut. Mood disorders, ADHD, depression, anxiety, all those things associated. Just about any chronic condition has something to do with gut health. I'm gonna take a small break. If any have any questions so far, you can unmute yourself and ask. All right, we're gonna keep going. So conventional medicine, most of we are a functional medicine practice. Functional medicine is addressing the root cause of why we get sick, why we get chronic illnesses. Again, most of that has something to at least in partial to do with the gut. Unlike functional medicine, which addresses the root cause, conventional medicine, which is your typical, doctor's appointment, pill for every ill kind of thing, is different, right? And it's very beneficial for people who have an acute illness, like if you have acute appendicitis or a heart attack or something extreme, like you get your arm chopped off in an automobile accident. Traditional or conventional medicine does a really good job of like saving lives. What we don't do a good job of is treating chronic illnesses because we are on this pill for every ill, this name it and treat it and band-aid it kind of approach. We basically diagnose it, we treat the symptoms, we really never treat the root cause. There's a lot of medication that's given. Our body is not deficient in any medication. Our body is not deficient in Xanax or Prozac or Zoloft. It's not deficient in stimulant drugs like Adderall and Ritalin. We're not deficient in those things. So anytime you take a medication, it is a band-aid approach. Most of the time the medication is not treating the root cause, with the exception of a few things like antibiotics that can be treating some of the root causes, but probably not all of them. I'm not against medication. We are integrative medicine, so we do use a lot of medication. My point here is that medication should not be the only treatment, and I don't think it should be first line for most chronic conditions. I do think that it needs to be a root cause approach, and then we can use medication to treat the symptoms just in the meantime, but it doesn't need to be a long-term solution. And then, of course, when all the medication fails, we end up with a surgical intervention. All right. So also we want to make sure that we touch on the fact that leaky gut is a real issue. Leaky gut, specifically, we're going to go in this in detail in a little bit, and especially in week 2. But functional medicine is addressing the root cause, and leaky gut has so much to do with what's happening overall in the body. Functional medicine seeks to restore balance to all the body systems by addressing what is going wrong in the first place. So what are the root causes, right? So we're introducing that functional medicine is going to address them. We need to be able to identify what they are. And this is just some of them. These are the big ones. This is not all of them. And I think there's actually a couple different screens that we can kind of look at some of this stuff, but diet's huge, right? I'm telling you, about 80% of what I do is tell people to stop processed foods, to stop the high sugar, to stop the inflammatory foods. And then being able to heal their gut after you can remove certain foods, their body starts to respond in a big way. But not eating the right foods or under eating or overeating too many foods is certainly going to upset the whole system. Stress is big, especially for females. We are just living in a chronic state of stress in 2024. We live through a pandemic. We have children, we have jobs, we have careers, we have spouses, we have friends, we have all the stressors of the world on our shoulders. And of course, we're trying to manage it all. And this is obviously going to disrupt what's happening in our gut because of the cortisol imbalance and what it does to the microbiome. We live in a very antibiotic culture. We overprescribe antibiotics for just about anything, any kind of strep throat or ear infection. We jump straight to antibiotics. Antibiotics are useful when they are necessary, but in most cases, what we're doing is just treating viruses with antibiotics, and we're doing the body a lot more harm than good. It takes about a year to replenish the microbiome, intentionally replenish it, meaning we have to take probiotics for about a year after one course of antibiotics. That's how much damage is done. It kills off, most of these antibiotics are not selective. They kill off all bacteria, right? Most of them are not going to just go, it's a shotgun essentially. Most of them don't just isolate the bad guys. It kills off the good guys too. And that allows for secondary infections like candida, yeast, and that kind of stuff. And then of course it damages the gut lining. And then of course the autoimmune conditions, we kind of talked about that, but any kind of autoimmune condition can actually damage the gut lining, and gut lining damages or can lead to autoimmune conditions. These are additional factors that affect the gut health. So food sensitivities are one of the things that we see a ton of in our practice. We're going to talk about that in detail. Leaky gut, we're going to talk about that in detail. Toxins, infections, malnutrition, and stress. If we, through a functional medicine lens, can address these 6 things, then we can heal the gut. And I do truly believe that. Now, it takes time. You're not going to heal the gut in this 4-week program, but you can start the healing process and then allow your immune system to do its job to continue the process that you've made. I tell people it takes about 2 weeks to see any improvement at all. And usually the first week, they can actually feel a little bit worse because you're having that die-off effect. You're kind of like repopulating the gut microbiome, and the body kind of takes a jolt, like, what the heck is going on here? And then the second week, you're starting to feel better, less inflammation, less fatigue. And then by week 4, you're starting to feel much, much better, but you're not healed. It took me about 2 years to heal my gut. Of course, it was absolutely destroyed from a lot of antibiotics and medications and other things like stress. But I do think that the body will heal itself. You just got to give it the right tools and remove what's not supposed to be there. So there are, speaking of food sensitivity, so we're going to take each of these 6 things and dive deeply into that throughout this course, this first week. So we're going to start with food sensitivity. So there are different types of food reactions. So there are things like an IgG mediated. So that's a sensitivity. So basically the IgGs are not going to be detected in a traditional scratch test or patch test on the back. This is not going to be detected typically through the skin. And if you had an allergy test in the past from your primary care provider or your allergist, it's very low likelihood that you actually had an IgG test. Those are sensitivities. So these are delayed reactions, right? They can take up to 72 hours in the body to actually show up. We'll talk about the symptoms of that, but it's usually not a full-blown like anaphylaxis. Your face swells, your lips swell, you can have some tingling, but IgGs are typically not like an IgE reaction. Those are true allergic responses. That's like an allergy to peanuts or shellfish. That's going to show up as an IgE mediated response. So those are going to happen faster. So an IgE is an immunoglobulin that your body makes when it sees certain foods. And anaphylaxis is not the only symptom. Some of the symptoms of the IgGs and the IgEs can be very similar, but the timing is different. IgEs happen within 3 hours. IgGs can take up to 3 days for them to show up. So that's what we focus in on our practice, because I believe that most people know if they have an allergy to eggs or fish. What they don't understand is that the low grade inflammation that's caused by the IgG sensitivities is really what we're missing, and we need to be able to test for those and be able to identify what that's going on in severe cases. Now, most of the time you can do just a basic elimination diet and let your immune system kind of reset itself if you're having mild symptoms, and most of the time we can get by with that. But if there's severe symptoms or full-blown autoimmunity, then sometimes we need to go looking for these things. And then we have things like that are non-immune reactions. So it's not the immune system at all. These are intolerances. So you've got your food allergies, which are IgE, your food sensitivities, which are IgG, and then you have your non-immune intolerances. Those are things like lactose intolerance or dextrose intolerance. So basically, you do not have an enzyme to be able to break down those foods. So you can have a gluten intolerance that has nothing to do with your immune system. Your body just can't break that break that down, and that can have similar symptoms. And usually these are very mild symptoms. They're just annoying, right? But those are not going to be detected in a traditional IgG or IgE reaction. And those are usually passed down genetically too. So if you don't make the enzyme to break down lactose or lactase, which is the milk enzyme or milk sugar, then you may have a family history of that. So what are food sensitivities? Again, they are adverse reactions to certain foods that can cause a range of symptoms. These symptoms can be anywhere from digestive issues, constipation, diarrhea, bloating, or they can happen not in the gut at all. So those are things like headaches, fatigue, skin issues, problems, like rashes or hives. And those are very, very different than what we just talked about, food allergies. We can certainly test for these food sensitivities. It's usually a blood test. We can do a full vial of blood or we can finger stick, either one. They're both very, very accurate into identifying that. And then, of course, the treatment is to eliminate those foods for about 28 days. The science shows us that a food sensitivity, once that your body sees that food, it can stay in the bloodstream for up to 21 days. So we usually do a 28-day elimination just to make sure everything is completely flushed out. And that kind of gives your gut enough time to reset. And then we do a slow reintroduction. We'll talk about that again in detail. But that will let you know if you have any reactions. Your body will respond to it. Once you get the inflammation on your system, you can really identify if you have any sensitivities. And then, of course, the sensitivity is through testing, and then we go over that in detail, what that looks like. Some of you did do the option to add on a food sensitivity test to your program, and we will be testing those. I think we've got most of them scheduled already. It takes a good 7 to 10 days for those results to come back. So we'll add to that as soon as we find out the results, and I'll do a video recording and upload and send it to you, the analysis of that, so you know what additional to eliminate. These are the 5 most common food sensitivities that we see in the US. So gluten, that's an easy one. I don't know that I've ever met a person that does not have a gluten sensitivity. It happens to everyone, or a gluten intolerance. So remember, the gluten tolerance is not going to show up on the blood work, but the gluten sensitivity will. So gluten is just basically, it's a protein, and it's not just the raw unprocessed food that's causing this. It's a lot to do with how we're processing our wheat products in America. They're highly genetically modified. They're highly sprayed with Roundup, which is a toxic pathogen or toxic ingredient that actually just can work like an antibiotic in our gut. And so gluten itself is just very, very, very inflammatory. You'll always meet and hear those stories of people who go to Europe and eat gluten and they do just fine. So we know it's not just the gluten. It has a lot to do with it, but it's probably the processing of the gluten in the US that we're seeing so many issues with. Dairy is another big one. Again, I don't think dairy in itself is a bad guy. I think it's the way we're processing the dairy in the United States. I don't usually advocate for raw dairy, raw milk, because there is a risk, of course, for bacteria. But people who have a dairy sensitivity do tolerate that a little bit better. So we do know it's something along with the processing of the dairy. But also you got to think about, it's not just what you eat, but it's what you ate. So for instance, if they're feeding those cows, super inflammatory gluten and corn and soy products, then of course you're going to get some of those antigens into your dairy supply. So it could be the gluten in the milk that's actually that the cow ate that's causing a lot of the issues. Soy's kind of controversial. I would say that probably better to stay away from soy unless it's organic soy. And even if it is organic, keep that in moderation. There's a lot of vegans that, only eat tofu or something like that, and they have terrible gut linings because they're eating so much of this genetically modified soy. Soy and corn are the top 2 genetically modified food sources in the United States. 90% of the corn and the soy that you get from the farmer's market, or not farmer's market, grocery store, like traditional conventional ways of getting your food, 90% is genetically modified. So if you get soy, make sure it says organic. Organic does mean non-GMO. Eggs are a common allergen. Again, I don't know that the eggs itself are bad. I think it's what the chickens are eating, how we're processing them. A lot of times these eggs are not supposed to be shelf life stable. If you've ever got eggs from a farmer's market, from a local farmer who feeds their chickens, organic grains and that kind of stuff, healthy stuff, that those eggs are only going to be shelf stable for about, a few days up to a week, right? But if you buy it from the grocery store, they have a shelf life of close to a month, which is really, really scary. So that's just not a normal process where eggs are supposed to go bad within a certain amount of time. So, um, avoid them for the elimination phase. But then when you try to put these things back in, if you're going to put them back in, please make sure that you're buying organic, buying local when you can. Nuts are another one. I do see some people having issues with things like peanuts and cashews and almonds, but it's usually the peanuts, which technically are not a nut, they're a legume. So it's like a bean, if you will. But peanuts are usually pretty inflammatory for people. And again, it's probably more along the lines of the mold that's in these nuts and seeds. These nuts and seeds are picked usually abroad, and they sit on your cabinet in a bag, in a plastic bag for, months at a time. That's not normal. They've been sprayed with something. Nuts are supposed to go bad. They get moldy. You can't see the mold, and you ingest them, and they cause a lot of inflammation. So these are the 5 most common ones. These are the ones that we're going to take out when we go through the elimination phase. And I'll give you the opportunity to remove a couple more. So things like alcohol and sugar, those are not considered food groups, but those are going to be removed from the diet as well, because we know that those are very detrimental to the diet. To the gut. So what are the symptoms of food sensitivities? Like, how do you know that you have a food sensitivity? Well, it can be anything, right? So the headaches, migraines, energy changes. I used to get so hangry after I ate when I had so many food sensitivities and didn't know why, or just got so tired, just want to lay down, take a nap. A lot of times that is a food sensitivity. Mood changes, so irritability, obviously skin rashes we talked about, digestive issues, and just bloating, like your body just kind of fills up with air essentially to help offset all the inflammation that's happening. And then a very severe intolerance to that food, or very severe reaction, I should say, to that food would be called an histamine intolerance. These are on the rise. There's a lot of people talking about histamine intolerances or mast cell activation syndrome. So that's a kind of an autoimmune type condition that it's a very severe reaction, but people don't tolerate even small amounts of histamine. So histamine is made in the body. It's usually made by your mast cells, which is a part of the immune system. Your body needs to be reactive and have a way to defend itself against allergens like foods and the environment. But there's a condition that's overproduction of histamine. Some people are either very, very sensitive to histamine, or they have a truly overproduction of it because the mast cells are unstable. And these people can get really sick really fast. These usually happen pretty quickly after a exposure to foods. Those are usually like leftover foods are bad for histamine intolerances. So things like salmon, especially fish. These people don't usually do a really good job with other high histamine foods like avocados. Sometimes coffee can be a trigger as well. But there's a laundry list of things that the histamine can be associated with. But generally speaking, what I see the most of is leftover foods, specifically fish, and then avocados are going to be really high, and wine as well. So usually these symptoms of these people are pretty sick. They get really flushed face. Obviously they can have abrupt diarrhea, skin rashes, and a lot of times they'll feel it in their chest. They'll start having rapid heart rate, and blurry vision sometimes, and just feeling lightheaded. When I'm in a flare, I have a couple of autoimmune conditions and I've stayed in remission for quite a while, but if I'm in a flare, I will be overly sensitive to histamine-based foods, so I have to be careful and avoid those. And the dietary management is basically just eliminating histamine-rich foods, and then making sure that you're not eating any additional foods that are going to trigger a histamine release, which is the allergens and the intolerances and the sensitivities. There are things that you can take for this. Quercetin is a natural mast cell stabilizer. Quercetin is a herb or an additive ingredient that actually is found in nature. It is found in the peels of apples and onions. But I'll be honest with you, like, to get a really good therapeutic dose to do anything, you want to take a supplementation. Quercetin is one of the best things to help manage histamines. But also, if you have a histamine intolerance, it is a symptom of a leaky gut and an inflamed gut. So you have to treat what's happening in the gut for your body to stop overproducing these histamines. So this is an example of what a IgG food sensitivity would look like. They usually come color coded. There's different tests out there. Most of them are going to test 86 to 96 foods. The big ones are going to be on here, like gluten, dairy, yeast, those kind of things. But then it's always a good idea to kind of look at some of the other healthy foods like proteins, animal-based proteins, even vegetables and fruits. We've seen some reactions too. All right, so we talked about the food sensitivities, and the next thing up is talking about leaky gut. Leaky gut is defined as an increased intestinal permeability. That's the technical name for it. Interestingly enough, if you talked about leaky gut, 10 years ago, then you probably got your medical license taken away like it was, this, hoodoo, like a leaky gut. What the heck is that? But actually, we've advanced in literature, and now the research actually proves that leaky gut is a real thing. And it's a real problem. And now we know what triggers it, and we know how to treat it. And there's no medication that I know of to treat leaky gut. This is through diet and supplementation. But it's basically tiny microscopic breaks in the intestinal lining. And the intestine is basically this donut-shaped hole that your food goes into, that it kind of helps you break down your food and you start to absorb the tiny nutrients. Well, the problem is if there's anything causing breaks in that barrier, then you're going to start getting toxins into your bloodstream. So I love this picture. This is a really good indication of like what causes leaky gut, what leaky gut is, and then what leaky gut causes. So at the top, you're going to see your triggers. So stress, psychological stressors because of cortisol imbalances, any kind of toxins. The medications are a big one, but glyphosate, which is the Roundup that they spray on our food. Genetically modified foods are also very toxic for the body. Pathogens like bacterial, viruses, and yeast can damage the gut lining. Food particles, like if you can't digest your food effectively, higher up in the stomach. So, the stomach is where you mostly digest a lot of the fat in your food. So, that or in some of the protein as well. And then the gallbladder releases its bile that helps digest more fat, and the pancreas releases its pancreatic amylase and lipase and other enzymes that actually break down the protein in your food. So if you're not digesting your food higher up in your intestines and in your stomach, then you're already going to have large protein and large food particles floating into your small intestines and your large intestines, and that's not supposed to be there. So people who are already on proton pump inhibitors, antacids, any kind of antacids, but the Nexium, the the Prilosec, and then the pantoprazole, the Dexalon, those are the worst ones because they shut off about 90% of your stomach producing pumps in your stomach. And obviously, if you don't have acid production, you're setting yourself at risk for an infection because acid kind of kills off bacteria and it kind of helps the stomach and the small intestine stay sterile. So you're increasing your risk of infections, but you're also not digesting your food. If you can't digest your food, then you're also going to lead to micronutrient insufficiency. So B vitamin deficiencies, magnesium, vitamin D deficiencies, those medications were really only supposed to be used for like 2 to 4 weeks at most. But a lot of people are on them chronically and they're going to have long-term issues. So, making sure that we're digesting our food, we're chewing our food effectively, we have enough digestive juices and enzymes to be able to digest our food. That helps break down the food so there's not large particles actually damaging the lining. Drugs are a big one. Anti-inflammatory drugs, aspirin, Aleve, Tylenol, not so much Tylenol, but definitely the Aleve and the aspirin are probably the biggest factors. Obviously, things like antibiotics are huge to do this. And then birth control. Birth control is really, really bad to damage the gut lining. And then, of course, we can see the other infections as well can do it. So if all these things or any of these root causes are in the gut lining, it basically starts to damage these cells, which are in blue with the purple nucleus in the middle of that. They start damaging the cell lining and they start breaking them apart. And so your gut lining is very thin. It should be thin for a reason. If it's like thick, like layers and layers and layers of cells, like your skin is, it would take forever for you to be able to get your nutrients into your bloodstream. So it's thin for a reason, but because it's thin, you're at higher risk for having an issue. So they're like soldiers. They stand shoulder to shoulder, really, really close together. And they're not allowed to let anything but tiny little particles of the micronutrients from the breakdown of your food. That's the only thing that should pass through. But these soldiers get weak and brittle because everything we just talked about, and they start to break apart. They get super weak, and you have these large food particles and toxins and bacteria floating in your bloodstream. It's not supposed to be there. The immune system sees gluten in your bloodstream or a bacteria in your bloodstream. There's going to be collateral damage. That collateral damage is your immune system creating inflammation, and that inflammation can go systemically. So all over the body. It's not just going to stay in the bloodstream. It happens all over the body. But if the body sees it over time and you have a genetic risk factor for autoimmunity, then it can actually activate the autoimmune system. So for instance, we've seen things like gluten for Hashimoto's, again, look very similar to the thyroid glands. The body starts attacking it. We've seen it also with things like Klebsiella, which is a bacterial infection, gets into the bloodstream and it looks like a knee joint or a wrist joint or some of the joint tissue in the body. The body starts attacking that. That's what rheumatoid arthritis is. So all of these autoimmune conditions have at least some component of a food toxin or systemic environmental toxin or a infectious disease process that's happening. And then, of course, just that systemic inflammation is going to lead to chronic diseases because of just all the itises, all the inflammation in the body has a leaky gut component to it. Toxins are another one. So we talked about medications being a toxin, glyphosate being a toxin. Heavy metals are another big one. So heavy metals are in sometimes your food supply. So cadmium is found in like non-organic chicken. Mercury is found typically in the environment you breathe it in. If you're near like a coal ash, we see that a lot kind of in our area of North Carolina with the Duke Power Plant. There's some issues there. Mercury is also found in a lot of old amalgams. So old fillings in teeth. If it's silver, it's mercury. Most of those have been removed, hopefully. If not, it's actually leaking into and causing some leaky gut. Lead is found in your water supply. That's why it's always a good idea to filter your water. We've also seen things like arsenic as well, and that's usually the component of a lot of rice. So if you go for a gluten-free diet and eat a lot of rice, then you can actually lead to more arsenic issues. So just being super careful. Usually when you buy organic, it doesn't mean you're not going to get any of these heavy metals. It's hard to avoid them all. But it's about reducing them where you can, and using living in a old house with lead-based paint, you can assume that that's going to be an issue. The things with these heavy metals is you could have been exposed to them decades ago, and they still could be in your body, leading to an inflammatory effect on the gut. And then pesticides, that's kind of redundant because the glyphosate is a pesticide, but there are other pesticides that are even organic pesticides that can cause some issues. Infections. Infections can be bacterial, viral, or even parasitic. And sometimes we see fungal infections as well. These are like the common infections that we see in our patients who have gut issues. So Candida is a overgrowth of yeast. Typical symptoms of yeast overgrowth would be things like energy issues, digestive issues, skin problems are really common, and then even cravings. So yeast feed off of sugar, so it kind of helps it to grow faster. So if you get a ton of sugar cravings, it could be an identification that you have a Candida overgrowth. Candida overgrowth is very commonly associated with antibiotic use. So when the antibiotic kills off the good guys, the bad guys start to overpopulate. You can test for Candida in the blood. You can also test for it in the stool. If you have a lot of vaginal yeast infections, you probably have yeast in the gut, and that's what's triggering it in other places of the body. So Candida is big. H. pylori is another very common one. H. pylori symptoms are usually more related to just the stomach, but we have seen some systemic issues as well, like headaches and migraines, that kind of stuff. But typically you're going to see some reflux indigestion, tummy pain, bloating, and heartburn. Very common H. pylori, and H. pylori is hard to get rid of, but it does need to be tested. And that's usually sometimes a blood test, and sometimes it's a stool test. Small intestinal bacterial overgrowth this is SIBO. You can have SIBO or SIFO, which is the fungal overgrowth, but what's important here is the location of it. So you have a ton of bacteria in your large intestine, right? It's very large diameter. That bacteria eats your fiber, eats your food, and then as a byproduct of the bacteria eating your food, it's gas. It creates gas. That's what bacteria does. And that gas, if it's in the large intestine, has a lot of room to go, and you basically just flatulate it out. The problem is if you don't have a good moving gut, so if you have what is called slow transit or constipation, things that can cause that would be things like other dysbiosis, Hashimoto's, or a thyroid, any kind of hypothyroidism, anything that's very sluggish. Medications can cause this, but also we've seen I guess chronic constipation, causing a backup effect essentially. So you just don't move anything through. And then that bacteria, so it likes to travel up from the colon, the large intestine, up to the small intestine where there's a very small diameter and nowhere for that gas to go. So people typically with SIBO have a lot of bloating. They feel like they look 6 months pregnant after a meal. It's very painful for a lot of people. And then we also I've had people actually tell me that they get bloated from just water intake. So that could be SIBO. And then we can have some malabsorption issues. So if the bacteria is in the wrong place, it starts to eat your food and you become very malnourished because of it. And then you can have any kind of other dysbiosis. I mean, there's so many other bacterial infections. We don't even know them all. We can test for them if we need to. But usually when I see people with chronic illnesses, I think of a general dysbiosis in the gut. So that's the bacteria, too much of the bad or not enough of the good is what's called a dysbiosis. So that's infections. Let's talk about malnutrition. So malnutrition is deficiencies, right? So if the gut is just constantly inflamed, if it's leaky, it's so busy, getting the large particles in, you can't digest your food. You can't break down that protein into amino acids or those carbohydrates into simple sugars, or your fatty acids, to fatty acids, if it's already in the bloodstream. So we see malnutrition, B vitamin deficiencies, magnesium deficiencies, vitamin A deficiencies, B12, you name it. All these can be secondary to a unhealthy gut. And also, interestingly enough, the deficiency itself, just because of lack of intake, can actually lead to leaky gut as well. So we know that things like vitamin D and zinc repair the gut lining. If you're avoiding foods that are high in vitamin D, like salmon and fresh fish, or foods that are high in vitamin and zinc, like seeds, nuts, and seeds, then you're probably deficient, and therefore it's going to actually increase your risk of getting leaky gut or gut permeability. We test a lot of these in our clinic because we see so many of them. And the last one is stress. So I think it's really important that we point out that the gut brain axis. So the gut and the brain are one continuous organ. They look alike. They both have this like back and forth rugae. They were basically created at the same time in utero. They are connected. They're very similar organs, and they're connected by way of the vagus nerve. So whatever's happening in the gut, those butterflies in your gut, it's because the brain. Whatever's happening in the brain, a migraine, a headache, it's probably because the gut. They talk to each other very, very commonly. And then we have these hormones that go back and forth as well, and cytokines, which are messages to let the brain know what's happening in the gut, and the gut know what's happening in the brain. So things like depression, anxiety, those are due to, in part, an inflammation in the gut that's causing inflammation in the brain. So you can't get the hormones that calm you down to the receptor site in the brain because of all the inflammation that's happening secondary to the gut. Or you can't manufacture those hormones because you don't have enough of the necessary products to do those. So basically, you don't eat hormones. Most of us actually make them ourselves. So things like serotonin and dopamine, that kind of that pleasure, reward, motivation hormone, and serotonin that calms you down, and magnesium, melatonin that helps you sleep. Most of those are made, at least initially, in the gut. 80% of the serotonin and dopamine that we have that calms us down and helps with our brain function is made in the gut by certain bacteria. So A, if you don't have that right bacteria, or B, you have inflammation because of blocking the receptors, or C, you don't have enough of the B vitamins and other minerals that help with that conversion, then you're going to start to see some anxiety, depression. Again, we do not have a Prozac deficiency in the US. What we have is a gut issue. So I had been able to help so many people get off of their antidepressants, which actually worsen their gut function, by addressing what's happening in the gut. And again, this takes time, it takes work, but you can certainly be intentional and get improvement. We've seen this with kids with autism and ADHD, so many things. And like I said, it's not just the behavioral stuff, so they like neurodegenerative disorders like Alzheimer's and Parkinson have been associated with what's happening in the gut. So what are we going to do to fix it? So we know what the triggers are. We know what the symptoms are. We know what the conditions are that are associated with bad gut. We have a protocol that is very scientifically based and will help support your body in healing the gut. So there's 5 steps to this process. Remove is the first one, which we're going to talk about tonight. That's talking about removing the things that are causing the gut to be imbalanced. And then next time we're going to talk about replacing, reinoculating, and repairing. So those 3 things together are basically putting things back in, right? So it's giving you the right probiotics, either through food or supplementation, the right prebiotics, the right postbiotics, replacing the digestive enzymes that your body needs, and then repairing that actual gut lining, so healing that leaky gut. The last thing we're going to talk about is rebalancing. So again, you can do all the supplementation, fix your diet, eat super clean, but if you're not managing your stress, then all of this is for naught. Like, you're still going to have some GI issues. So again, this 5-hour protocol is developed to help restore gut function and heal the gut. It takes a while, but usually within about 28 days, that's when we're really going to see that symptom improvement. But you have to continue this for, it depends. It depends on how long you've been sick for and what's actually happening for us to, people like celiac disease. I mean, I keep them almost always on a 5-hour restoration protocol, just depending on what's going on. So the first thing to remove. So if we're going to talk about remove this week, we're going to talk about removing the things that are causing issues. So we talked about some of them already. we're going to go more in depth about the toxins, like avoiding toxins in your food supply. That's going to be in a different module in a different week, but we're going to focus this time on the infections, the food sources of inflammation that we need to remove, and any kind of bacterial, fungal, or yeast infections. Now, depending on what's going on, sometimes these do need to incorporate an antibiotic course, but then that just creates more collateral damage. So I prefer not to go into, prescribing antibiotics. You do whatever you can do through food and supplementation as best as possible. Even if you don't have diagnosed clinical evidence of these things, if you have the symptoms, you can kind of go ahead and treat empirically. Most of the treatment is super benign, so you're not going to have any reactions to it. And most people can tolerate them very well. But Candida, that's the yeast, H. pylori, that's the bacteria, small intestinal disease or bacteria. Interesting enough, there's herbs, and I firmly believe that God gave us tons and tons of herbs to actually help our bodies heal, and we can use them. We've known about these herbs. Most of them come from Chinese medicine or very traditional medicine, and we can still use those very safely to kind of help support the system. These herbs are like things like garlic and ginger, oregano. You can certainly eat these in your diet. I can tell you though, if you've got a rip-roaring infection, it does help to take them in supplementation. I have a couple different options for this. If you want to augment your protocols, your program, you can certainly reach out and we can, offer these herbs. We sell most of them in-house. These are scientifically studied in individual, so we know that they're safe and effective for most people. You can't give herbs to anybody who is pregnant or breastfeeding, so you have to be careful with that. But most of them are used to kill off the gut, and then some of them are used to repair the gut lining as well. And then we're going to talk about the removal of food triggers. So most of you are going to be getting a food sensitivity analysis so we can know specifically what's going on. For the rest of you, we're going to put you through, well, at least everyone's going to go through a 5-hour restoration. So we're going to start removing the 5 main common food triggers. So gluten, dairy, peanuts, soy, and then eggs. And then we're also going to add to that highly processed foods, sugar, and alcohol. So processed foods is anything that's not found in nature, right? So this is like a chip bag that's got seed oils in it and everything else. Is that this is not naturally found in nature. Now, if you want to make your own potato chips with a little olive oil and roast them and put some like sea salt in there, that's totally fine. But if you get it from a grocery store and it has a label on it, you can assume it's probably a very processed foods. Those are what we're going to be able to avoid for 28 days. So in preparation for elimination diet, this does take some preparation. I would tell people, please don't start this diet tomorrow. This takes a little bit of time. Prepare yourself over the weekend and maybe consider starting this on Monday after you've had the weekend to buy your groceries and food prep. We will give you tons and tons and tons of resources. I've got recipes on recipes, and I've got an extended biography about why we're doing what we're doing. If you're a reader and you want to learn more about what it's doing to your system, you're welcome to kind of deep dive into that. So that's going to be emailed to you, I believe, if it hasn't been already. And again, that's a really good opportunity to use the WhatsApp group chat to ask questions and give other people advice of things that, like, gosh, I found this and I prepared it this way. If you love to cook, share that with the group, help each other out and kind of motivate each other. But I would say that most people need to wait till Monday to actually start this. So we're going to remove those 5 food groups, and then that's done for 28 days, and then we will start to reintroduce those at the near the end of the program, but we can't do it all at the same time. So, you can't eat pizza on day 1 because that's got gluten and it's got processed foods and it's got dairy all on the same day. So we will walk you through how to reintroduce those. But for all intents and purposes, 28-day elimination diet, hopefully starting for most of you on Monday. Again, the WhatsApp group, most of you have already been set up for this. If you have any trouble with that, please message us. You can just text the number. It's easy enough, and we can help you walk through this. This is not mandatory, and it's not secure in terms of, like, people see your phone number, and then if you give them your name. So, if you're not comfortable with that, then I would probably avoid the WhatsApp group. We're not selling your number or anything like that. It's just so if you don't want your name associated with it, then you just don't give that information. So again, we're going to be sending you recipes. If you have any questions or you don't receive them, please text the number. I do want to go ahead and do a comprehensive review. So the goal for tonight is to talk about the elimination diet, to remove and repair it. I did have photos of the elimination-based food plan, but that is also going to be on there. Let me see if I can find that for you real quick, because I think that that's important. We're going to go over this next time. Let me see if I can find that for you, because I thought it was in the, You guys can go ahead and start in the chat box if you want to, any questions that you do have while I get this elimination diet pulled up. That's the Mediterranean. That's the wrong one. Now, for some of you who've already completed our wellness-based program, you don't have to do the full program. You can certainly just take the ones that you know you're reacting to and take those back out, just as an encouragement to take those back out of your diet. You already know what you're reacting to. If you do fine with eggs, you can put that back in. Again, those are for the people who've already gone through one of our wellness-based programs. We've already made them go through the stress of the elimination diet. Why am I not finding this? All right, I think this is the unedited version, but you get the idea. So we don't restrict calories through the program, so you can eat as much as you want to. The key is don't get hungry. One kind of thing to know about this thing too is the elimination. The program actually eliminates beef. I would say it's probably okay to have beef as long as it's clean, organic, but it is removal of some additional. So this is even more strict than the 5-hour restoration. If you can't do the full elimination diet, then at least do the 5 food groups that we just talked about, which is dairy, soy, gluten, peanuts, and eggs. If you want to challenge yourself, then take the rest of the stuff out that's on here. But it's not that much more strict, other than it says you can't have pork or beef. I would say you'd probably be okay with beef, most people. My concern is that you're going to get malnourished if you don't have something. We do give you the fish that you want. We don't want you to have a whole bunch of shellfish. We do all wild game is fine. So buffalo, you can actually get that in traditional grocery stores now. Chicken, turkey, all that stuff is fine. You can do plant-based protein, so like pea and rice based. If it says vegan on there, that's totally fine as long as it's gluten-free. I didn't put a serving size on here, but most of you, a serving is going to be about 4 to 6 servings a day, which is eating about the palm size amount of protein, 4 to 6 of those a day, roughly. Now, don't eat because I'm forcing you to eat 4 servings. If that's too much for you, listen to your body. The thing is you want to make sure that you're getting enough protein in to be able to help your body heal. Amino acids are necessary for gut healing. Legumes, those are beans. Again, you'll see that no soy and no peanuts on here. I would say probably about 1 to 2 servings of these a day. And it shows you the serving size here. Now, you have an edited form on yours that actually has our brand label on there that is going to be emailed to you if it hasn't already. So there's some modifications in there. We just give you more information, essentially. So dairy-free, so we give you some dairy alternatives. You can do almond milk. Just check the label to make sure it doesn't have any additional super processed oils or sugar. Nuts and seeds are great. These are great to kind of keep your appetite under control and keep your good source of protein for your blood sugar. So usually about a handful is 1 serving. So a closed fist of almonds, that's 1 serving. You can have up to 6 a day if you'd like. I'm sorry, that's 6 almonds. You can have up to 4 servings of nuts and seeds a day. A closed fist is your serving size. So disregard the 6 almonds or the 2 Brazil nuts. It's what
Hey, Diana, I'm sorry to interrupt. I can't see any food list.
You can't see it?
No, I'm seeing long-term gut health support.
All righty, let me see. I may have to stop sharing and try again. Thank you for letting me know. There it is. Can you see it now?
Yes.
Okay.
Yeah, I got it now.
This is going to be emailed to you. So you will have it. It's going to look a little different because it's branded and it's some modifications, but this is going to be emailed to you. And then the fats and oils, those are things like avocado, nuts and seeds. Now, granted, if you know you have a reaction to high histamine foods, like we talked about in the presentation, those are going to be identified in red. And if you are super sensitive to those things and you know it, just avoid the things in red because those are high histamine.
Okay.
Fats and oils, about 2 to 4 servings a day, roughly on average. Vegetables, we want you to get as much good quality vegetables in a day. Get a variety in. Don't just eat green beans every day. Get a variety of these things in. Like you haven't tried it before. You know, your taste and your appetite is going to change throughout the program as well. Be expected to hate something going into it and actually love it at the end of it. So challenge yourself and get a variety in. Roughly on average, we're supposed to get about 6 servings of non-starchy vegetables a day. I know that sounds like a lot, but that's the recommendation. Most of it's just a half a cup. So half a cup of, spinach would be 1 serving. Starchy vegetables, those are your butternut squash, your purple potatoes. I don't want a lot of white potatoes if we can avoid it if possible. If you need a little bit, maybe just 1 serving a day, and that's a very small, like half of a small potato. No corn, if you can challenge yourself and get the corn out as well. roughly about 1 to 2 servings. We don't need a whole bunch of this just because of the carbohydrate count. Fruits are amazing. They're healing, but they are higher sugar content, which feeds candida. So stick to 2 a day, 1 to 2 servings. Again, closed fist is about 1 serving essentially, or half a cup. I would prefer to stick with the berries, the blueberries, the raspberries, the blackberries. Those are naturally lower in sugar. So we're a little bit more generous on those. Stay away from the dried fruits like the dates and the dried they're orange. My brain just shut down. I don't know what they are. Anyway, dried fruits are higher in histamine. So if you have a lot of those histamine intolerances, stay away from those things. Gluten-free grains, we're not super generous with these. This is 1 to 2 servings. So half a cup of rice is 1 serving, half a cup of steel cut rolled oats. Don't assume just because it says rolled oats on there that it is gluten-free. It has to have the label on it or it's not checked for gluten. Brown rice is a really good alternative. Quinoa is a really good alternative. So if you're one of these people like me that just has to have some grains, 2 half-cup servings a day is the recommendation. As far as beverages, like I'd really prefer you to stick with like water or a little bit of sparkling water. Don't overdo it. It's so much carbonation in that can actually mess up some of the bacteria in the gut. You can do probably some unsweet tea or green tea is probably okay. But we really don't want you to do a lot of fruit juices. I know it says it on there. It's really high in sugar and it can bloat a lot of people. Stick with water. If you want to do some coffee, try to find organic, 1 cup a day, and you can't put anything in it, essentially. That's the hardest part for a lot of these people is giving up their coffee. So I'm going to be flexible and say you can have 1 cup a day, but it has to be black if you're going to do it. Other than that, it's going to cause some gut issues. Interestingly enough, like coffee is has a lot of mold in it. So a lot of people react to it and they just never know it because they do it every single day. So that's gonna be a little challenge for people. And then obviously no alcohol. So that's the elimination diet. Again, we're gonna email that to you if it hasn't been already. Any questions? Let me go ahead and start with the chat box here. And then of course, if anybody wants to, okay. All right, she was just letting me know that it was there. Any questions? You can unmute yourself. You can put it in the chat box. I'm gonna hang around for, I don't know, maybe a minute, 60 seconds if there's any questions. Obviously, I always find that when people have questions, it's like the whole group has the same question. They're like, yes, thank you for asking. That's what I was going to ask. So don't be shy. Ask the question. There's no bad questions. I guess I did a really good job going over this stuff. That's what I'm going to claim anyway. There we go. What will a colonoscopy tell you? Colonoscopy will tell you if there's any structural issues to the colon lining. So the colon is your large intestines that will not address what's going on in the small intestines. They're not looking for bacteria, right? Bacteria is microscopic. They're not looking for that in a colonoscopy. That has to be done with a functional stool culture. But any structural changes, so we're not talking about the function of the bowels, like the nervous system or movement or bacteria. We're talking about structural changes like polyps, colon polyps. We're looking at severe diverticulitis can be seen through that as well. So anything that's actually, it's usually a functional medicine issue first, right? It's a functional issue like the bacteria, the inflammation. And if that's not addressed, that's when we start to see the structural changes happening. So colonoscopy is really going to be more of a cancer screening and looking for things like inflammatory gut disorders like Crohn's or colitis. You're not going to see typically celiac through that. Sometimes you will, but usually that's more in the small intestines and polyps or sometimes diverticulitis. Breakfast ideas. So I don't eat a lot of breakfast. Breakfast is always a challenge because a traditional breakfast is always pancakes and gluten and eggs. It is challenging. I totally get that. So it's going to be an unconventional breakfast, right? So it might be a grilled chicken breast with a little avocado with it. It might be a protein supplement, like an organic protein supplement. We do have some of those here if you are interested in something like that. I like the Orgain that's over the counter. You can get that about every any pharmacy that's out there is an option for that as well. I tell people, protein powders are still processed foods, so don't make it a staple in your diet. But if it's something that you need to supplement a couple of days a week, 3 days a week, that's probably going to be okay. But breakfast is probably not going to look like a traditional breakfast. Now you can have some turkey bacon, you can have some turkey sausage. That's still kind of a processed food, but that's lower processed than, a bag of cookies in the morning. There are recipes that we're going to give you for breakfast, but just beware, they're not going to look like a traditional breakfast. I like chia seed pudding for that as well. Chia seed, so you're getting like the full fat, canned coconut milk and then adding chia seeds, which are great for the gut, great fiber, and then you can add some berries and nuts and seeds on top. That's a really good alternative as well. It's a texture thing for a lot of people, so some people just don't love it. You can get dairy-free yogurts as well. So the cashew yogurt, almond yogurt, those kind of things, and do like a parfait that doesn't have any dairy in it. Anything else? Any other questions? I like the idea if you want to. Again, I don't want anybody starving. I like the idea of doing some intermittent fasting too. If you're doing this for and hoping for some additional weight loss benefits, intermittent fasting is a great opportunity to cut some additional calories out. What we don't want to do is stress the adrenal glands out, like if your blood sugar goes too low. So if you're a person who gets up and runs 5 miles in the morning, you probably are not going to be a breakfast skipper. But if you're someone who normally eats breakfast around 8 o'clock, and you just want to wait till about 10 o'clock, try that and see if you feel good. But that's also a really good opportunity to get rid of some challenging breakfast ideas, is to do some intermittent fasting and see how that makes you feel. I tell people not to fast more than like 18 hours. That's too much. Typical fasting would look something like a 9:30 to 7 o'clock in the night, or 9:30 to 7, or 10 to 6. So you can eat between 10 a.m. and 6 p.m., or you can eat between 9 a.m. to 9 a.m. to 6 p.m. could be your feeding window, or you can eat from 10 a.m. to 7 p.m. You can pick those two options. And try to get filtered water when you can, because of all the just junk that's in water. So if you're drink a whole bunch of water to kind of keep your appetite down and kind of keep your gut nice and flushed, then try to get filtered when you can, and no bottled water. That's going to be bad. We're going to talk about more in the toxin issue, but like, I don't want you guys to go out and buy, gallons and gallons and gallons of plastic water bottles, or drinking just a ton of tap water, because it is super toxic. So try to get a water filtration if you can. And we're going to make sure that we go over that in any issues. Acid reflux, gut issue. Acid reflux is absolutely a gut issue. Acid reflux is oftentimes a deficiency in digestive enzymes. So you don't make enough digestive enzymes. It can also be bacterial overgrowth from the H. pylori, or it's a food sensitivity. So, if you are allergic to gluten or dairy, then it's just going to sit there for a long period of time and cause a backup response. So yes, acid reflux is so common in the United States, but it's usually one of those three things. So it's food sensitivity that's causing inflammation in the gut lining, B, a bacterial infection like H. pylori, which probably needs to be tested and treated, or C, not enough digestive enzymes. And we're going to talk about a little bit more about how to replace digestive enzymes and that kind of stuff in the next chapter. All right, I'm going to hop off here. Feel free to continue to ask any additional questions in the WhatsApp chat. That's a great way to do it. If you're having technical issues with either the recording or getting what you need, that's probably better to send through our main channel, which is 828-838-1225 number. If you want to copy the slideshow, you're welcome to it. We will attempt to send it to your email. It may be too large. We have to figure out a way to do a Google Drop. So if you want a copy of it, just you can put it in the WhatsApp, or you can text the main line. Either one. Thank you so much for being attentive. I am going to record this, stop the recording. And if you have